Hi everyone, thank you for attending our virtual dental shadowers session today. We want to remind you that we will not be having a quiz at the end of the session today. All right, let's get started. We are very fortunate to have um, Dylan Sharma today for today's session. I'm handing the mic over to you. Feel free to start whenever you want.
All right, perfect. Thank you, Shabnam, and thank you, Samantha. So my name is Dylan Sharma. I'm a third-year dental student at University College Cork. So today I'll be talking a little bit about myself, the dental school application process, as well as dental school itself. So let's get started and let's have some fun. So a little bit of background information about me. So I'm actually Canadian. I was born in London, Ontario, Canada. It's about 2 hours from Toronto, if you guys are unfamiliar with it. Um, I wanted to be a dentist since I was 7 years old, actually. So kind of living the dream here. So I actually did my undergraduate degree at Western University here in London, Ontario. So you guys can see that I did an honors specialization in kinesiology. So I got a bachelor's of science in that. I graduated in 2019. So talking about like undergrad, basically at the end of the day, I knew I wanted to be a dentist, and I knew that I needed specific courses to, apply to dental school. So I had to pick an undergrad program that, I could fulfill the prerequisites. So there was the basic sciences that you had to do for, most dental schools. Some of them would be like biology, chemistry, organic chemistry, biochemistry, all those types of courses. So you do have to have a good background in science. Um, but at the same time, I was passionate about like sport, exercise, the body, physiology, all those kind of things. And I was interested in kinesiology, which is the study of human movement. So, I was excited to see that I could do a bachelor's of science in kinesiology at Western. And I tell a lot of people this, but it was like one of the best decisions I've ever made. I met a couple of my best friends at Western, made good connections after that, had a great time my 4 years there. So, it's what I'll say is, for when you're applying to dental schools, you shouldn't necessarily that there's only one specific program that you have to apply to. It's very much just the prerequisites you need that are important. So as long as you can kind of get all those prerequisites out of the way, then you should be good. So yeah, I was lucky with my degree that I was able to do that. So then currently right now I'm a third year dental student at University College Cork, or UCC, and that's actually in Ireland. I'll explain a little bit more in the presentation later on why I decided to go to Ireland for dental school. Um, yeah, so I'm actually in my third year now. I have 2 years left. So before I kind of talk about why I decided to go to UCC, I can kind of talk a little bit about the application process. Um, Back in 2019 when I started. So basically, in 2018 of September, that's kind of when I started to like get serious and start looking at different dental schools, what they needed and everything. So then I knew that like Ireland was an option as a Canadian student that I could apply there, because there's a few countries, like there's Ireland, there's Australia, and then there's New Zealand. Those are like the three countries that, if a Canadian studies dentistry there, there's a few schools that they have that are accredited, so that I could come back and practice dentistry without any, entrance exams or all those additional types of exams. So yeah, so I started the application process in September. I knew I needed like reference letters, personal statement, all that kind of stuff. So just kind of starting it early. Um, I remember in my year, the deadline was in January of 2019. So I just like for the first round basically. So I submitted all my documents basically, I think January 1st. And then yeah, I got in on March 1st, 2019. One of the best days of my life. I remember that day very. Um, but yeah, so that was I think UCC, the way they did it was in rounds. So I think they had like a first round, which was around like March, like around that time. I'm not sure when they had the other rounds, but Yeah, like they were, I think it was a rolling basis basically. So I know that my class has, I think, total of 59 students, but that's including everybody. So we have, Canadians, we have people who are from Ireland, people from Australia, people from like China, like different places around the world. But I believe, I think there's 23 of us Canadian, including myself, but it's around that number. So it's a small class for sure. But yeah, so I got in that day, and then I started in 2019 of September. And this that picture of me is just with me and my degree from Western. So some tips for dental school applications. I like to keep things simple, but yes, we'll go with point number one first. So take time to write your personal statement. So when I say that, I mean, don't not like a week or something, but like plan it out. Like I remember with mine, I probably took a good month and a half just kind of chipping away at it. Like I didn't go obviously all in one night, write my personal statement, because along the way you'll read it again, you'll have other people read it, and there's things that you want to change, some things you want to add. Um, so take your time with it. I would recommend that you get other people to read it that you're close to, you trust, because sometimes you might read something, you think it's great, and then somebody else reads it and they give you really good advice, and they critique it properly. So take time with your personal statements, yeah, because usually the question's pretty like similar depending on the school, but usually it's kind of like, why are you like an asset to dentistry or our dental school? And you have to sell yourself because you only have a certain amount of words or like pages that you can write, right? So it's very important. Yeah, there's probably a few resources that you could look at like online, like how to write a personal statement, but at the end of the day, it's like it's you writing about yourself and you just telling them your story, why you should be in the dental community. Another thing was make good connections with your mentors. So mentors are people that, like along the way, whether it's like undergrad, high school, your dentists, just make good connections with them, get to know them, let them get to know you. Um, so like I know with like undergrad, a lot of our professors would say like, eventually if you want to apply to like graduate school or like professional school, like medical school or dental school, you're gonna have to ask for a reference letter at some point. And with your references, you want your professor to have good stuff to say about you more than just, they took my class and they did a good job, because they said that happens a lot where will do great in somebody's class. They'll come at the end of the year and say, I need a reference letter. And all they can really write is, they did well in my class and that's about it. So I would recommend that, you take a course like an undergrad or a few courses in undergrad, because you'll need probably a reference letter from like a university professor, at least the applications that I did needed that. Um, but yeah, so like when you're doing that, get to know your professor, ask them important questions. And then yeah, I'll talk about this a little bit later, but like with research positions, like it's important obviously to have a good connection with your mentors, like your professors. But then again, also with like dentists, like I have very good relationship with my dentists. I've known them over 20 years now. Um, but yeah, they knew me obviously quite well. I did like quite a bit of shadowing with them, which I'll talk about in like the next point. But yeah, so like pick dentists and like people that that can write good things about you, right? Because you can't really read what they write about you, but you want it to be good for your application. So yeah, so then the next point I would say is do plenty of shadowing. There's no limit to the amount of shadowing you need, and I know that a lot of dental schools, they'll ask for like a specific amount of like certain hours that you need of shadowing. But yes, like the picture I have on my PowerPoint here, that was actually in high school. So that was in grade 11. So I guess if you're American, you would call that your junior year. So yeah, I remember I did a co-op with my dentist practice. It was from like September until January, but I learned a lot in that time. I got to see the different specialties and just see the day to day and what a dentist actually does. And like that's very important, right? If you're going into a career, you want to see what they actually do and see if you like it, because you might think, oh wow, that I definitely want to be a doctor one day, and then you go and you see what they do and you're like, that's not for me. Yeah, that's good though, because you kind of save yourself all that time, right? So That's yeah, there's no limit to shadowing. And then yeah, like I would recommend doing it as early as you can. I remember in undergrad I did it quite a bit. I think it was when I was in second year I did quite a bit of shadowing, and it's just great experience because even in like in dental school now, there's stuff that you will learn like obviously through theory and then like your practical stuff, but then there's stuff that you won't learn like in a practice setting, like the business of dentistry or just even patient care in general. So it's very valuable. So yeah, get as much shadowing as you can and as possible. And yeah, it's great. Something that I recommend is to get involved with research. So this is like specifically when you're in undergrad, because like it's a good way to show your initiative and like to get like good things like leadership and all that kind of those kind of things that dental schools are looking for. So when we're like in dental school, you're always going to have to look at research. Like that doesn't just stop at like a master's or undergrad or PhD. Like that always continues. So like with us, like say if we're like using a specific dental material, and we want a new material gets introduced into the market, and we want to see if we should start using this. You don't just search on Google like is this any good. You have to look at the literature, evidence-based dentistry. That's something that my school is like it's very they tell us a lot about, and it's true, right? So research was something that I got involved with in my third year of university, kind of going back to like the good connections with your mentors. But I had asked one of my professors, like, because I was really interested in their one of their classes, and I just told her, like, I find your class very interesting. Is there any chance that I could get involved with research with you? Like I'm available in the summers or throughout the year, and she said yes. Like it's all about having, you have to ask them first, right? So that was really good. I remember I was like a research assistant there, and then that was like, a great experience. Like also like, it taught me a lot of stuff. So very valuable. And then like be yourself. So, that's kind of cliche, but at the same time, it's, you want to be yourself, not the version that you think dental schools want to see. You want to be kind of unique and you want to stand out, because with dental school like applications, there'll be tons of applicants, right? And there's only a certain amount of spots, and if everybody's kind of the same, then it's hard for them to pick you out versus somebody else, versus like you say if you have the same GPA and all that kind of stuff, right? So be yourself, like get involved with different things, kind of continue with the things that make you who you are. And yeah, so be yourself. So advice to stay motivated. So yeah, these are just a few things I like to do to, stay motivated, especially in dental school. So I'm one of those people who likes to like plan things out. So say if we have an exam in like the end of October, that seems like a far away, like when you're in September, but you write that on your calendar and you see like, okay, that's actually, it's only like a certain amount of days away. You plan out your work schedule, you study like a certain amount of time each day. You kind of work out your study schedule or schedule for other stuff, right? Because you have to have a social life as well. That's very important in dental school to keep you with your mental health, everything, all that stuff. But yeah, plan your schedule out, because like if you keep your schedule planned out, helps with motivation, because it's like, rather than be like, oh, that's so far away, it's like, oh no, it's not really that far away. If I just do a little bit each day, then it kind of builds up, and then so when it comes to exam time, I'm not going to be too stressed. I'm not going to have to worry about like, oh no, like having to pull an all-nighter or something like that. You'll be ready for it. Make attainable goals as well. When I say that, I mean like don't plan out to be like, I'm going to study like 30 hours over the weekend, because that's just not good for you. Like some people can do it, and like kudos to them. I just know for a fact that me personally, that never works for me. But yeah, like look at your courses. This is like for undergrad as well, right? Like you can see that like if I can put a couple of hours per course, this day and then another day, and then you get that done throughout the week, that's, you've reached your goal. And then a couple hours each day, that adds up over time. And then like when it comes to exam time, you'll be great. So make goals that you can achieve, because if you make goals like the example I said before, and you're not able to achieve those, then you're going to be like, I didn't do it that first time, so like what's the point of setting other goals about the next time. Another thing I cannot stress enough is to take breaks. Breaks are very important. Like you're going to get burnt out basically if you just continuously study. That's what I find. So I kind of have a golden rule for myself. I like to call it the 2-to-1 ratio. So I study for 2 hours and then I take an hour break, whether that hour's like used for lunch or something, or like going outside, having a coffee or tea break, just anything, right? Because I find like when you have something to look forward to, like even throughout the day, whether it's like an hour break, you are so much more productive because you want to get as much done as you can in those 2 hours. So yeah, I found that very helpful in terms of staying motivated, just looking forward to my breaks. Reward yourself along the way, like if you have a certain goal of like what you want to achieve in one of a course or something, like and you meet that goal, treat yourself, buy something nice for yourself, go shopping, spend time with friends or something like that, uh, but yeah, and then just at the end of the day, remember what you're striving for. Um, for me, like I said before, I always wanted it to be a dentist, but there's some days that you kind of forget that, like kind of forget what you're all the work you're putting in is for. So actually, the picture on my PowerPoint here, that little toy, I call him the little dentist. So I remember one of my birthdays when I was younger, somebody got me that, and then. I left that on my desk basically. I think it was like at the start of undergrad, I kept it there. So you have tough days and then, you just kind of look over at your desk, you see that there, and then it just instantly, it just reminds you, why you're doing what you're doing. And then, just something to keep you motivated. And then, I love Nike. So, just do it. Perfect advice. So, choosing dental schools. So what did I look for in a dental school? So yeah, I kind of touched about this like a little bit earlier, but yeah, I chose UCC because so it was in Ireland. It was one of those countries that was accredited with Canada. So they have the three countries: Ireland, Australia, and New Zealand. So I knew that there was two schools in Ireland accredited with Canada. It was UCC, and then there was Trinity. So then when I was doing applications, I applied to those schools. So basically the way it works for us is you obviously complete your 4 years there, and then in your fourth year you write the licensing exam, the NBDE, so the National Board Dental Exam, I believe. So then you write that in Ireland, and then that's just your licensing exam. So when you come back to Canada after your 4 years, if you pass that exam and you've obviously got your degree, you're a full-fledged dentist in Canada. And that to me, that was like awesome, because I wanted to study abroad as well. It was just something I wanted to do because I lived in London. I never moved away from home. But yeah, and then what was great about UCC was they offered a 4-year program, because a lot of the programs in Europe, they do like a 5-year program. So they call it the graduate entry. So yes, 4 years. So basically, if you you have to do an undergrad to be able to apply. And then so with that, like our first 2 years, so like yeah, so if there's 5 years programmed for them, so our first year is like a mix of their first 2 years, and then moving forward. So I just finished my second year. That was really year three for them. So yeah, and then a place that I would enjoy living. So yeah, obviously I researched Ireland before I left, and I chose that school because I'm gonna be spending 4 years there. Was the mindset. I want to live somewhere that I'm gonna enjoy. There's stuff to do. Ireland's it's a beautiful country. There's a lot to do there. Fortunately, with COVID, I didn't get to see it that much last year, but then moving forward, we should be able to. Yeah, how did I determine the other important factors? So yeah, like I talked to like a few of my friends who studied well, not just for dentistry, some for medicine. So and just kind of seeing what they thought of it. Like one of my friends, one of my really good friends, like she studied medicine in Ireland, so I talked to her quite a bit. And then yeah, like from that, I kind of got the idea about Ireland. But then obviously through research, and then one of the dentists that I actually shadowed, who wrote one of my references, he studied dentistry in Australia. So then when I was like, looking at dental schools back in undergrad, I also started looking at, into that as well. And then, I've only heard good things about studying abroad, how it was like one of those like once in a lifetime like situations that if you get the opportunity to go for it, and you have to do it. So, I have no regrets picking Ireland. It's a great place to be. I really like my school. Like, yeah, I love UCC. It's a great school and everything. So, yep. So that was one of the important factors. And then, yeah. So then lots of research prior to. That's important, like, just in applying to dental schools in general, right? Like, you wanna make sure that, when you're taking your courses in undergrad, that you have all the prerequisites that you need to apply to some schools. Every school is different, though. Like, some schools, I remember they needed, like, physics, or some of them needed, like, anatomy, um, right? So you have to kind of have an idea of where you want to apply, and then, yeah, go from there, basically. So actually, yeah, I kind of wanted to go back here. So then kind of like in terms of, yeah, another thing I kind of wanted to talk about was staying motivated. What I kind of like remember now was there will be naysayers along the way for sure. There'll be, people like guidance counselors or even some professors just along the way that will they'll look at your statistics, or they'll kind of see what program you want to do, and they'll be like, I don't know if this is the year for you, or something like that, or maybe you should just apply next year and maybe like do some courses. But at the same time, like, they don't necessarily know what's best for you. And whenever they said that, I just took that personally. Um, it wasn't really to prove them wrong. It was more to prove me right, kind of mentality. At the end of the day, you got to bet on yourself. That's one of the quotes I really like to live by. But yeah, like, there'll always be, you look at the statistics sometimes, and it's very daunting sometimes. Like, you just look at how many like spots a school has, and like how many people apply, and the marks you need. But like, you got to believe in yourself. And yeah, that's just another thing to stay motivated. So thought I would touch on that. So a typical day for me. So I was going to talk more about my second year that I just completed at UCC. So with the COVID pandemic, it was very different, like the structure for us this year. We were online for 7 out of the 10 months. So they try to get us back. I remember, like, when the pandemic happened last year, they thought we would be back in September, and then they told us we'd be back in December, maybe, sorry, January maybe, and then they decided on March. So for us, it was the first 7 months, so from September to like the middle of March, or the end of March. That's when we were online. So, and you know what, like, for me, I actually didn't mind online. I liked how you could kind of make your own schedule. I'm an early bird, so like I would wake up like pretty early, like 6, and then start studying, like, do my lectures and everything by like 7 o'clock. And then, I would do my that 2-to-1 ratio thing basically, and then be done maybe by 5. So, it was like a typical kind of day. Like, you'd start like at a certain point, and then it's regimented and everything. But yeah, so for us, for online, we had 5 total courses, but like it kind of broke down into like, 3 main ones. So the first one was like dentistry courses, which you'll have obviously all throughout dental school. So there's different topics. These are not all of them. This is just a list of some things that I enjoyed learning about. So obviously one of them is about like restorative. So like, fillings, that's kind of your bread and butter. Peds, oral medicine, perio, radiology. So yeah, like different professors who are like specialized in those, we usually teach them. You'll have like, say, like maybe a week you'll just do peds or something, or maybe like oral med. That'll be a significant portion of your course. Yeah, but you'll be doing that. I remember like I think if I were to pick one specialty that I really enjoyed learning about this year, it would be peds, which I was really surprised about. But yeah, I just really thought that was interesting how like different, you have to approach working with children and like all that kind of stuff. And people always ask me like, do you want to specialize one day? And I always say like, never say never. Like, when I applied to dental school, I had the mindset that I wanted to do general. But yeah, so like, I'll keep my options open. Obviously, like, residency spots are tough, but yeah. So peds was an interesting one. I also enjoyed like, obviously, restorations, learning about all of that. Another course that we learned about online was pathology. So it wasn't just limited to like the mouth. We covered stuff like cardiovascular, the cardiovascular system, like respiratory, hepatic, all that, like pretty much all the body systems. So it was a very interesting course because it would always tie into dentistry, in some sort of way. Basically, like, if this patient came in, say if they had like a valve or something, how would that change your treatment plan? So very interesting course. And then another course that we had was dental pharmacology. So yeah, like once again, like we learned a lot about like drugs and like certain types of drugs and like drug interactions were something that, you have to know for sure. Like when you come with a patient, medical history is super, super important, right? Because if they're on a drug and you prescribe them something, even something simple like a painkiller, like there's an interaction, you have to know how to deal with that kind of stuff. So yeah, we like learned how to like, different like antibiotics, like if there's infections, all that kind of stuff, pain. Yeah, so all those courses were very interesting. But yeah, this is dental school, so we wanted to get our hands-on experience as well. So we were in person though, which was nice. From basically, yeah, April until July 2nd, we were in person in Cork, Ireland. We were doing practical. So basically, it was kind of into three categories. We did like restorative lab. We called it OTL, so like operated techniques lab, where we like did fillings, all that kind of stuff. We did prosthetics, so like we were in the prosthetics labs learning about like dentures and all that, and then assisting in the clinic. So for like restorative, so we were there for like 12 weeks. So like half of it was learning how to work with composite, so like resin composite, that's like your white fillings. So you basically with like operations, you prep, which is drilling, which is obviously that one picture there. There's different types of fillings that you would do. So there's class one, that's like when you have like say like a molar or something, and it's just like the top surface or the occlusal surface. There's like class two, which is like when it's interproximal. So like in between the teeth, there's like a cavity. You got to drill down there. Class three is like when it's on the incisor, like in the middle. Class four is like say if you like chipped a tooth or something, you got to do that. And then class five is more if it's like along like the gum line. And then yeah, so yeah, like we learned how to like work with composite. So there's different steps. You guys will learn this in dental school, or you might be already learning about it. But yeah, so like you obviously prep and then you etch, which is the blue stuff you work with, and then you got to apply bonding agent, and then yeah, you for a composite, you don't want to fill it all together unless it's a bulk fill material. So we put it in increments. In dental school, we call it polymerization shrinkage. So basically, yeah, like you want to avoid that. So if you put it in increments, it helps with like post-operative sensitivity. So we learned like in dental school, kind of basically how to apply the composite in a specific way, and then obviously you want to kind of carve the filling so that it replicates the tooth anatomy, which is another thing you learn about actually in first year, tooth morphology and all that kind of stuff, which is very important. So then, yeah, like with composite, what else did we learn? Oh yeah, we learned how to do like the rubber dam, which you would use in like other settings, like if you're doing like endo, like a root canal. So like that's important. And then what else? Oh yeah, we learned how to do matrix bands. So like matrix bands is say if you're doing a class two, which is like when the cavity is like in between the teeth, you use that matrix band. So when you're filling the tooth, like you have like, some support and then something to kind of shape the filling. And then you don't want it to obviously touch the adjacent tooth because like when you cure it or solid, you don't want it to be bonded to that other tooth. And then we also worked with amalgam. So amalgams are those silver fillings. They are being phased out. You'll learn all about that in dental school, but it's still important to learn about them because if a patient comes in and say they need a replacement of their amalgam, you do know how to do it. It's a very different material than composite. It's very what's the word? It's very durable. Like it lasts a long time, but yeah, like you have to be careful because it's an environmental issue. That's why they're phasing it out. So there's like a specific way to dispose of it. But yeah, like it's more like you obviously do your prep, you drill like in a specific way, and then you fill it with the amalgam, and then it's just a little bit faster than a composite curing. But yeah, it's another restoration technique that we learned, and then we just worked on mannequin heads this year with COVID. Before COVID, we would be, I think we would have worked with patients in our second year, but then, for just safety and everything, and then also the amount of time we were in the practical labs. So we did that. So then we also did prosthetics. So One of the pictures I have here is the top one. That's a special tray. So we learned how to make those. So yeah, when you have you're doing a denture, basically, you can't just use any tray. It has to be like a specific one. So you take an impression and then you make the special tray for that. The second picture is what we call a wax rim. So like when you're making a denture, you start off with wax and then you add teeth to it, and then like you kind of make your denture that way, and then you would send it off to the lab. Actually, most of the stuff is done in a lab setting, but then yeah, so then they make the denture, and that's kind of what you do. So we did that. We made tons of casts. So casts are like you see how there's like that yellow thing on top of the wax. So it's just kind of a mold of your teeth. We also like learned how to like polish like dentures and all that stuff. We worked with regulators, which is also like, it was a great experience. I enjoyed working with the dentures and all that. And then we assisted in the clinic. So we assisted like with upper years, like people, whether they're in third year or 4 year, like final year, which is like, it's great because you get that great experience working with dental students, seeing what you'll be doing obviously in the next year or two. But then you see like, yeah, like what patients, like how that's a very different setting than working with like a phantom head or the mannequin head. So yeah, no, I enjoyed doing that and everything. So yeah, so I'm starting my third year at the end of August. Really excited for all that. So yeah, let's see. Q&A. So if you guys have any questions, yeah, feel free to. I also left my Instagram handle at Dylan the Dental Student, because you might not think of a question right now, and then maybe you want to come back later, and then it's just easier. I always just let people like just message me directly on Instagram. I'll totally get back to you because it's very important.
Okay, so there are a few questions in the YouTube live chat, so I'll just read them out for you. The first one is, did you get waitlisted, or was your acceptance in March your first correspondence with the school?
Yep. So yeah, it was my first correspondence. So yeah, I did not get waitlisted. So yeah, like what I said with UCC, they did it in rounds. So yeah, I remember with my year, I think the first round was like, it was like March 1st. That's when I got in. So I think that's when they did the first round. I think now, I was talking to my one friend who's in the year on just a year younger than me. They were saying that I think their early acceptance was in or their first round was in like late February, but it's around that time point. I'm not 100% sure when the other rounds are. I don't want to give you a month and then be wrong. So but I will say that like even if you're waitlisted, because I remember talking to one of my friends and they had said that they had got their acceptance in, I think it was August, and we started in September. So never give up on until they say no for sure. Like if you're waitlisted, doesn't mean you didn't get in, right? That means there is a spot. It's gonna wait until they see. So to answer your question, I did not get waitlisted. I was in the first round of offers, and it was great the way that the offer kind of landed, because like I knew I wanted to go to UCC, and then like it worked out in that way. Like I accepted it obviously, and then yeah, I just had enjoyed the rest of my undergrad. I wasn't stressed anymore. Obviously, I had to finish my degree, but like a huge weight off my shoulders. So hope that answers your question.
Yeah, that does. That's great. So the second question is, um, does it have to be dental related research? I'm working on a paper about depression, but I'm worried it might not count since I'm not working in a lab.
No, it does not. So yeah, that's a great question. So yeah, with my research, I was actually so I was the course that I was really interested in it was like exercise neuroscience. So like neuroscience is one of those things I was like, this is so cool. So then yeah, the professor, like that was kind of what her research was in. So I remember I was working with like cognition and like what was it, the prefrontal cortex, pre-diabetes actually. So we were looking at like seniors, basically who had pre-diabetes. So people who were just on the just about to get diabetes, they were kind of just on that scale of like the blood glucose. And then we were actually looking at like the MRI scans and just like cognition tests, basically to see their executive function. Um, so that was very interesting. That has nothing to do with dentistry, right? But it was still a great experience. And like a lot of my friends I talked to who were involved with research, like they weren't doing dental research, right? But it just shows that, you took the initiative, you got involved with something that, uh, that's, it's important. Because like I said, like research is something that continuing throughout dental school that will always be important. So yeah, to answer your question, no, it was not dental related. Do any research that you can, to be honest. Like any research is, it's really good experience and everything. So yeah.
Thank you. How do you think being an international applicant affected your application, if at all?
So from the way I remember, I think they have a certain amount of spots for Canadians. I don't remember the number. It's around 20. So there is quite a few applicants. I remember talking to Atlantic Bridge, which is the agency that you apply through. So their agency basically sends all your information to the school you're applying to. So I was applying to UCC. So you kind of send all your information through there. But yeah, yeah, if you want to look at that, search Atlantic is that like all the information that you would need is there. And if you want to just talk with one of their representatives, like that's what I did a lot of that, like throughout like the September till the January. I would talk and ask them like questions like, okay, like when should I submit this, or like, how many references is too many or something like that. But no, like you are obviously competing against other internationals, but there is a certain amount of spots for the Canadians, because this graduate entry program that they introduced a few years ago at UCC, it's for I believe it's for Northern Americans. Like I don't believe that there's any Irish or anybody from other schools in our graduate program. So I hope that answers your question. So there will be, but at the same time, there will be people that you're obviously you're up against, but that's like with anything, right? Don't think of it like that, because then it'll drive you crazy, because like you see the amount of number of people applying, and then yeah, just know that you have a chance. That's what I'll say.
Yeah, absolutely. So far, what was the hardest class in dental school, and what was the hardest thing to get used to?
Okay, yeah. So for me, this is all like everybody's different, right? So one course that I found was hard that I had to, study quite a bit with was pharmacology. There's just a lot of drugs and interactions that you have to know about. And it's not something you can just memorize, because there's like a million drug names you have to know, right? So it's just something that you have to actually understand. That's another thing in dental school. It's memorization can get you can get you somewhere, but at the same time you have to understand things. So that's why I felt like pharmacology, like both in first year and second year for me, were difficult, because our exams, like the way they were kind of like, they were like essay based. So you have to like kind of write about like a topic, and you have to kind of show your understanding for it. It's not just straight up memorization, just spilling facts and everything. So that in terms of getting used to, like obviously like when we're in the like doing practicals and stuff, I would say like indirect vision. Like so indirect vision is like when you're working like on like the maxilla or the upper teeth, and you have to use the mirror to like give yourself vision when doing the like a prep or even the filling. So I remember that I was just like, how do I do this? Because your posture, it's just not great, because you tend to want to lean forward or something like that. But that took me a little while. I'd say like I don't know, like maybe a week or two. But then I felt like I was actually more comfortable with indirect vision as we progressed. It was weird to say, yeah, but like yeah, I remember that that was one thing that kind of took me a little bit getting used to, in terms of like practical based. So hope that answers that question.
Okay, so another viewer has asked, how do you balance time on the golf course with time studying?
Well, that's a great question. So yeah, no, I feel like I know who asked that, but so yeah, with the golf course, so yeah, like for our when we were online, basically, I always left time, like so I would try to end the day around 4 o'clock or 5 o'clock, and then yeah, book that tea time, twilight rate doesn't matter, and go play with the boys, because that was very important to me, social life, obviously with COVID, with all the isolation, but yeah, no, very important. So yeah, I managed to just like once again going back to planning my schedule out, but yeah, it's important. So
Mhm.
I did make time for golf for sure.
Okay. Um, what is some advice you wish you had before investing time and money into dental school?
That's a tough question. So some just advice. Okay, yeah, like just if you feel like you're interested in it, go for it and, see if what opportunities you can have. Like, say, like I mean, like, there's no really age, like, say, like you're in high school or something. Dentistry is one thing I want to, get involved with. You're at the dentist one day, just ask them like, is there any way sometime I can maybe watch you or, something like that. Like that's pretty important advice that nobody really tells you though. Just kind of, I was lucky in the situation that I was really close with my dentist that like he was, they were totally fine with me doing that kind of stuff, but not everybody has that. But yeah, just as early as you can, as soon as you kind of have that interest, try not to like wait until undergrad to see maybe it might be something for you because if you get it out of the way, say if you don't like it, then you can maybe pursue something else, like maybe medicine or something in research or something like that. So because you obviously like you don't like with your the whole like a money thing, right? You don't want to go through dental school and then be there and be like, is this something for me? And then at that point it's not too late, but you've invested time, you invested money into it. So as soon as you kind of get an interest into it, start and just see if you can get involved in any way. I just hope that answers that.
Yeah. So the next question here is, what's the learning format? Is it problem-based or traditional learning?
So yeah, no, it depends on the course. So like in terms of problem based, like if you're asking about like like let's like let me think the way. So like if they'll give you like say a case, right? So like say something like pathology, they will give you a patient A has this kind of stuff. They give you like they explain like the symptoms or something like that, and they'll be like, what do you think the diagnosis is? So at the end of the day, like you're not like, okay, like well, let me just like think about that PowerPoint and like let me memorize whatever that is, right? You have to think about it because there's not always like one specific diagnosis for something. So yeah, problem based. There obviously like some courses of which do have memorization, like anatomy. There's just stuff that you have to know, like the different nerves, like muscle, like innervation, function, all that. There is memorization in dental school, but even anatomy courses like that, they could always bring up a case or something because that's kind of the situation that you are working as a dentist, right? A patient will come in and say, doctor, I have this problem. Like, what is it? They're not gonna, say, oh, it's this muscle, and it's supposed to do this, right? So you have to kind of apply all the information you learn, and then into the setting at the end of the day. So does that answer that question? It's a
Yeah, that's perfect. So another viewer has asked, um, how do you make yourself stand out from all the other applicants?
kind of goes back to that be yourself kind of mentality, right? So like for me, like, very different in terms of I decided to do kinesiology, right? I'm not saying that like most applicants will do like say something like medical science or like health science or life science because I was very close to actually choosing that. But like just do something that you like, right? Because it'll show in your application if you're saying that like I did this for my undergrad and like I got involved with this and I got involved with say like student council or like which is something I did. I took time to get involved with like charity work or I had sports stuff that I like to do, stuff that like like that would maybe you would think that's like okay, not every student would have that. For me it was like the research thing because it's like I was very lucky in the sense that I was able to get that opportunity and like a research assistant position. So yeah, like something that just like what you think and that would maybe not somebody else would have, but then yeah, being something that you enjoy, right? If you're passionate about music, like try to pursue that as far as you can because if you can say I stuck with piano or something from like the age of like 4 till like 20 or something, right? They'll show that, oh, that's commitment, right? And then like kind of in dentistry terms, like, oh, that's a lot of hand skills or something like that. But yeah, just be yourself, like follow your interests. There's obviously not a specific thing that like checklist that you have to do to get into dental school. Everybody's different. That's what's the beauty of it. Like I talked to a lot of my friends and like we all have different backgrounds. Everybody did a different undergrad. They took a different route. Like some people needed masters, like whatever it was, right? But at the end of the day, yeah, be yourself, do what interests you, and then that will kind of make you stand out, I think.
Yeah, absolutely. So another question. Um, Also, I remember you said your class size was around 60 students. What is the pros and cons of a smaller class size?
Okay, so pros, like, I mean, it's great. You get to know like everybody and everything. Because like in undergrad, I found like in undergrad, I also did have a smaller class size. So like in kinesiology at Western, we started out as I think it was like 350 kids, but then since I did a bachelor's of science, it was only 75. So it was a very small class in that sense. So like I did get to know quite a bit of like my classmates. Obviously, you have different, friends that you make along the way that you're closer with. But yeah, like I would say that one of the big pros is like you're really close with your class and everything. Everybody's there to support you. That's another thing with dental school. Nobody's out there to be like, I would out compete against this person. I want to get like the highest marks. Yeah, that might be the case in terms of residency, but I feel like my class is really good in that sense. It's tough to think of a con though, to be honest with you. Like, I really enjoyed the small class size because, yeah, for that reason. And then, like everybody's together and like, not like overwhelming with many kids. So yeah, sorry, I couldn't think of a con.
Yeah, yeah, of course. How do you, how much do you learn in school about the ins and outs of running your own professional practice?
Yeah, so I don't want to knock dental school, but like this is something that I feel like a lot of dental schools they just don't cover. They have to teach like I guess the science aspect of dentistry. But we've been asking like our school like if we can maybe get some way to learn a little bit about business. But then I asked dentists like that I know like when did you learn about business? And they say they learned about it when they started working like like so if everybody's kind of in that situation like you learn about it while watching other dentists work and then you kind of gain that experience as an associate and then one day if you want to open your own practice you kind of get that sense but yeah from this standpoint at this point in like dental school we haven't really learned that much about the business aspect like how to like own a practice or like run a practice but you learn different things like one thing we learned about this year was like the legal aspect of dentistry which is very interesting because like that's obviously very important things like consent like what's best for the patient kind of thing so that was kind of like a like an introduction to see like what practice life is like but I think it's one of those things that you just kind of learn more about like when you're out and working yeah.
Mhm. Okay. So how many people in class have loops?
So that's a great question. So our school is I don't like to say old fashioned but it's old fashioned in the sense that because I have a lot of friends who like have dental school in the US and from what I understand is they like to get their loops like within the first week. So our dental school likes us they liked us to learn how to do the fillings and everything without the loops. Just in case we're ever in a situation where it's like, oh, like what if your light breaks or like something like that? What if like I have no idea, like your lens falls out? Will you be able to do the filling? So but moving forward like so I remember like actually some people in our class did buy loops while we were there the 3 months so they were testing them out they were like working with like different magnifications there's different ones you can like start off with like 2.5 3.5 and then you basically go down the line more when you're working like say with like something like endo like root canals but yeah so actually yeah like this summer like buy loops because it's a huge investment. So you want to like look into different companies. That's don't just go like look at one company and be like, okay, I have to go with these guys. So yeah, I won't. So I ordered my loops. I won't reveal like what company I went with or anything like that. But I just ordered them. So I'm excited to use them for next year because I know how to do fillings now without my loops. And then obviously like talking to dentists and stuff, they said it makes your obviously the ergonomics and everything, your posture, everything, great. So I will say magnification wise, it's also personal preference as well. But yeah, like do your research on loops as well. Like I said, it's a big investment, but I will say like it's a good investment to go with in dental school. A lot of the loops companies like they'll explain that if you buy loops outside of dental school, the price is significantly higher, and you do have like quite a bit of discounts as a dental student. So if you're at UCC, like yeah, just in your second year, if you're going into your second year or something, I would hold off and then kind of just speak with your supervisor. Like my supervisors were all for like if you had loops on you, go ahead and use them. But yeah, like they wanted us to learn without it first. I'll
Okay.
be using my loops next year.
Okay, so the viewer also just asked another question related to that. They just asked, so in first year you don't need loops or you can still bring them?
So if you're going into first year, I mean, bring them if you want to. If you already have them, like I don't see any harm in bringing them. But at the same time, I don't want to be like, yeah, you'll bring them and then you'll be using them because it depends on your supervisor and it depends on the way they want you to learn, right? So yeah, if you have them, go for it.
Okay.
Yeah.
Yeah, yeah, okay. Another viewer has asked, how do you store your things when going back home, and how long are your breaks?
Okay, so when I come back home, so the place that I'm staying at in Ireland in Cork, it's a 50-week lease. So it's a townhouse basically. So then I just leave all my stuff there, and then like I bring a certain amount of stuff back with me. But like, yeah, like I leave like clothes and stuff. I can leave that there. But then when I'm coming back, like I like to bring food because like that's something as a Canadian that like there's certain things I just like from home, like the Kraft peanut butter or like KD like craft dinner, just some stuff like that where it's like they have it there, but it's not the same. So yeah, that's what was the other part of that question? Sorry, you asked like where I store the stuff.
Yeah, they said when and how long are your breaks?
So it depends. So I remember first year we had 4 months off in our summer, and then so after second year we had 2 months off. So we finished at the start of July, and then we're starting at the end of August. Um, so I had 2 months now, and then I think next year it's like a month and a half or something each year. But that's not just UCC. That's like every dental school. I have like one friend who's like in the States, and they were saying that like between D3 and they have a week off for their summer. But yeah, like for Christmas, I was looking at our schedule. I think we have a couple weeks off, and then we have Easter break. That's a big thing in Ireland. We get another couple weeks off. So, but with COVID now, it's different. Like it's not as easy to
Mhm.
go home. So put that into mind. But yeah,
Yeah, okay.
we
So
do
I
get a break
think,
though. It's not all year round though.
oh, okay, that's great. So I think this is the last question. Are classes mandatory attendance?
Yes, yeah. So it depends on the professor, but I remember a lot of the courses they will literally to have an attendance sheet, or if it's online, like if it's a live event, they'll like keep an eye on who's actually at the Zoom meeting or the Microsoft Teams meeting. Um, but yeah, like for online for us, there was a lot of courses where it was like asynchronous learning, so it was like pre-recorded lectures. So obviously those like you do have to watch them, but there's not like a attendance thing that they're checking. But yeah, if we ever had like say like a Q&A or a tutorial or something, attendance counted. So you'll have to be at those sessions, and then obviously in person, like the cadaver labs, like that's very important. Like the tooth morpho, like that's stuff you have in first year. But even like an OTL with like restorations and stuff, even prosthetics. Like when I was there just now, you always have to fill out an attendance sheet. So yes, it's mandatory attendance. Yeah.
Mhm. Okay, so we just had one last minute question here. How do you pack for the weather in Ireland?
So, because like the weather there in Cork specifically, it's like temperate weather. Like, so I would say like it's around like 10 degrees, 15 degrees, but it does rain a lot. I'm not going to be one of those people and say, oh, it rains all the time. It's miserable. We have nice days there, but I would bring like obviously a good rain jacket. I'm one of those people who gets cold. So I always have like a winter jacket as well as like a winter hat, scarf, gloves. Invest in a good umbrella. I will say that if you're coming to Ireland, invest in a good umbrella. But yeah, like that's in terms of clothes. Waterproof shoes, that's something I invested in like this year. Get boots or something like that. But yeah, like so like the weather is the summer was nice. Like when I was there recently, gets like probably 20s or something. And this is all in Celsius. But yeah, throughout the year, it's never like if you're coming from Canada, it's nothing. Like it's not even close. So you won't be too cold there.
Yeah, yeah. Okay, so that was our final question. Thank you so much for taking the time to talk to us about your academic journey. It's truly appreciated, and I know I learned a lot from your presentation. To our viewers, please remember for this session we won't have a quiz, and I just want to thank you once again for taking the time to talk to us, and everyone else, just have a great day.
Oh, thank you guys. Great opportunity. Loved it.